Well, a new study from JAMA Pediatrics shows that pregnant mothers who become infected with COVID could lead to a greater risk of complications during pregnancy. And joining us this morning with more on that is Dr. Robert Atlas from Mercy Medical Center. Thanks for joining us this morning.
Morning, Jen. How are you?
I'm good. So tell us more about this study. What did it find?
Well, it's finding what we've been seeing, which is there's increased risk of a number of things: hospitalization, ICU admissions, slightly higher risk of even death. And so we're still seeing it even in where we're working. We have a very sick woman right now at the University of Maryland. So it's here, it's still, and that's a problem.
And so what do you think the contributing factors of this are? I mean, they're still learning so much about COVID. Is it that when you're pregnant, you're a little more vulnerable to some of the symptoms of COVID, or does it all go hand in hand?
It goes hand in hand. I mean, we've seen it. And this study actually showed that if you're overweight, they use the term overweight, not obese, but overweight was a risk factor in and of itself for pregnant women. We know that pregnancy reduces your immunity, so therefore you're at increased risk of complications. And we learned from other infections like H1N1 flu that the pregnant patient was at real risk. And this is just showing us that in another study that there's a higher risk of complications.
So the information about the vaccine has been coming out for months now, and the conventional wisdom is that pregnant women should get the vaccine, but the organization, the CDC, is still not formally recommending it. So what is the latest guidance? Because I feel like one minute we're told yes, the next minute we're told no when it comes to pregnant women.
Yeah, there's really nothing that's saying you shouldn't get it. It's, I think, something that you have to be careful with and talk to your physicians. That's what they've all been talking about. There is a study out that shows that it's safe in the third trimester and that it actually is protective of the infant. So we're all recommending, I am clearly recommending to all my patients I encounter to get the vaccine. When we see patients getting really sick and dying from it, it just makes sense to get the vaccine.
And is there some evidence, I think you just alluded to it a little bit, that the vaccine might have some protective effects on the baby too?
Yes, this one study actually did show that there was immune antibodies in the infant, which would be protective. So it's not only protective to the mother, but also to the infant, at least in the early studies that we've seen.
And so far, is there any evidence to suggest that the side effects could be worse for a pregnant woman than a non-pregnant woman?
Related to the vaccine,
Yeah.
or for no? What has been shown is it's very similar to the vaccine that we all got. Sore arm on the first one, a little low fevers and myalgias on the second one. So there is no difference in vaccination side effects.
All right, Dr. Atlas, is there anything else about this you'd like to add that I didn't ask you?
Yeah, it's just that anyone watching this, if you haven't been vaccinated, get the vaccine. It's going to help you, and if you're pregnant, even more so.
All right, I'm so glad you joined us this morning. Thanks again, I really appreciate it.
It's nice to be with you all.